Good afternoon, everybody. This is Val. I wanted to just outline what is going to be on your midterm and what the format is so everybody knows what they need to study over the next week and focus your study. So just want to be clear that this exam is worth 100 points. It is an ExamSoft exam, so please make sure that you've updated your course software with ExamSoft. You can just go on the website and make sure that everything looks okay. And there's a nice little tutorial also for that. So if you haven't updated since school started, please make sure you do that this week. We do have a diversity of questions on this exam from multiple choice, short answer, alternative format, and fill in the blanks. The exam covers 4 different coverage topic areas from that we've covered up to this point. So the first one is the public health systems and history of community health nursing. The first focused area of study is really understand and be able to explain the 4 different levels of the global public health system. We talked about that in class 1. And there's all kinds of links that you should explore before the exam to make sure you're confident in what each organization is for. The second area is identify the primary roles and relationships of each part of the public health system. Make sure you understand the enforcement role versus the educational role of each public health organization. The next area that you should spend some time on is the United States Essentials of Public Health, which we talked about in class. We had a little practice on a quiz and want to make sure everybody is fully aware of those public health essentials. The last area of focus in this first part of the exam is to compare and contrast the public health nursing role as it's changed over time. Make sure that you are able to speak to at least 1 or 2 examples, and please don't limit yourself to the examples that we had in class. Make sure that you feel confident in comparing what nurses did historically and what they do now and what might be different in public health. In the second area, I want you to focus on epidemiology and community assessment. We did some activities in class and you had a little practice quiz. I'll put some more examples online this week to understand and be able to calculate incidence and prevalence rates. The second area of study, make sure that you are able to give good examples of what public health databases are used for in epidemiological work in the United States. Be able to use the databases, make sure you understand what each type of database, what kind of data that provides. And again, all the links for those databases are in our PowerPoint from week 2. Apply the knowledge of the databases and practice collecting databases specifically to answer nursing type questions. The last part of that piece of the exam content is on defining the steps of a windshield survey, or in our case, a basic community assessment. Again, think through the process as we discussed it in class and in your assignments. Make sure you understand what the steps are. As far as our content area, we want the next area that we're practicing in is environmental health and genomics or genetic testing. Make sure that you take some time to understand why nurses need to assess environmental health when they're looking at populations or communities. Be prepared to review and apply environmental health issues of global concern to global nursing practice. So why do nurses care about topics like water, climate change, contaminants, chemicals, for example? The next area is defining genetics or genomics. Make sure you know the difference between the two. There's a nice little video from Jackson Lab available to you for that. I like Khan Academy does a nice job also if you want to take a peek at those videos. The next piece of study, make sure you understand the role of the genetic counselor. What are they for? How would you talk to them if you were a nurse that needed to make a referral? And then the next area would be on the ethical decision-making framework. We talk about that in class on Monday. Make sure that you are comfortable and understand the steps in that process. The last area in this module section is to be able to navigate and make decisions regarding ethical decision making. And don't forget, nurses never do decision making alone. The last area that you need to practice and study this week is on the concepts of infectious versus contagious diseases. Make sure you understand the difference. Please describe and demonstrate the impact of the infection cycle that comes from a vector-borne disease such as Lyme disease or even equine encephalitis. The next focus of study areas: be prepared to describe nursing care needs for a patient with an infectious or contagious disease. We gave a number of examples in class from TB to HIV. Make sure that you understand what are the key components of nursing care in those disease processes and how you would handle that as a public health emergency. Compare and contrast the different types of precautions used in public health emergencies, and we did have a little practice in class on different types of precautions, so make sure you're solid from standard precautions to airborne to contact to transmission precautions, and know when to use each. The last component that you'll be tested on for this exam will be define primary, secondary, and tertiary prevention. Make sure you understand the differences, and then make sure you're able to define the nursing role in health promotion and prevention. So my suggestion is make sure you review all the PowerPoint slides and all the discussions that we had in class. Remember, you're a nurse, so keep the focus on nursing and nursing care. And Alicia and I will see you in a week on October 2nd. We will have the exam in class, and it will be the first thing. So we'll start the exam at 9 o'clock. Thank you so much.